My name is Michelli, and I'm the Executive Director and the Managing Attorney for Think Dignity. Think Dignity started in 2006 by a group of women, mostly attorneys, who saw an issue with homelessness in San Diego and wanted to do something about it. At that time, we did a lot of outreach to folks experiencing homelessness. And one of the main concerns of people experiencing homelessness was the lack of access to public restrooms. And so at that time, we organized an advocacy campaign to get 2 Portland loos installed in downtown. They were 24/7 restrooms. This was over a decade ago, and we still continue to see a lack of access to public restrooms for folks experiencing homelessness and for the community at large. The issue of access to basic sanitation still matters today because we still have a lack of access to public restrooms. This is something that's important for our entire community, for public safety as a whole, not just particular populations, but for everyone. When I talk about the issue of homelessness, it's really the end result of systemic failures. So the same populations that have historically been marginalized are also disproportionately impacted by the lack of access to restrooms. Think Dignity has been working very closely with researchers at San Diego State University on a project called Project for Sanitation Justice, where we have researched and audited the restrooms that are currently available within the county of San Diego. In particular, this research will help us to provide recommendations to our county and our city on what we should do with increasing access to public restrooms. This includes building more 24-hour public restrooms that are available to the community at all times during the day. One of the challenges that we're seeing in the issue of increasing access to public restrooms is that people don't understand that this is a public health issue for the community at large, and not just an issue for folks experiencing homelessness. I encourage folks to think about your access to public restrooms and what does that look like? And how do we think about solutions that are more equitable for everyone in our community?
Hi, my name is Megan Welsh-Carroll. I am an associate professor in the School of Public Affairs at SDSU. I am also the co-founder and director of the Project for Sanitation Justice. Sanitation Justice is a vision that our team has for making sure that everyone in San Diego has access to basic water, sanitation, and hygiene resources. The average human being goes to the bathroom 5 to 8 times a day, and much more than that if you have any sort of chronic health issue going on, ability issues, whatever that looks like for you, you probably need to access the restroom even more than that average. And so what we're really trying to achieve here is to shed light on this issue, the lack that we don't have enough water, sanitation, and hygiene resources. The Project for Sanitation Justice is a community academic partnership among San Diego State faculty and students working in a wide range of fields, from public health to city planning to computer science. And we partner with our wonderful community partner, Think Dignity, who has been advocating for public restroom access in San Diego for more than 16 years. Our team, our academic team, does a variety of different research projects on public restroom access. We started by mapping all the public restroom facilities in San Diego County and making that information publicly available on our website, bathrooms.sdsu.edu. There are so many barriers to public restroom access in San Diego. First of all, there simply are not enough facilities. Then the facilities that do exist are in a poor state of maintenance, and often folks tell us that they don't feel safe using the facilities that do exist. Another issue is that there is very little information publicly available about where restroom facilities are and their hours of operation. Lastly, I'll add that very few facilities, public restroom facilities in San Diego, offer menstrual products and offer those products for free. There are so many solutions to this issue. that the Project for Sanitation Justice and Think Dignity are really advocating around. First off, we have so many public restrooms that are just not available to the public. Second, folks don't know where to find public restrooms even when they do exist. We need to make that information much more available. Third, we need to explore creative public-private partnership solutions to bring more public restrooms on board. And lastly, we need someone, especially in the city of San Diego, directly responsible for this issue. For our team, the future of sanitation justice looks like a San Diego where every resident has access to the basic water, sanitation, and hygiene resources that they need to live their daily lives with dignity. Moving forward, we're advocating for our city and county to take much more responsibility for this issue. But in the meantime, we're asking folks to get educated about this issue. Start following Think Dignity on social media. Start following our Project for Sanitation Justice on social media, and check out some of our work.
My name is Judy Voss, and I'm the Public Affairs Manager at Planned Parenthood Action Fund at the Pacific Southwest. Sanitation justice is reproductive justice. One of the main pillars is that we have the right to raise our families in a healthy and safe environment. And that includes being able to take care of our bodies with resources, with access to hygiene products, menstrual products, and public bathrooms. Our Planned Parenthood supporters can get involved with this work by first signing up to volunteer with our department. We also have our social media campaign where people can learn about our updates, and that's where you can get information on making public comment, coming to City Hall, going to the county. We really just need people showing up and making their voices heard. At Planned Parenthood, we talk a lot about stigma. Abortion is stigmatized, our bodies are stigmatized, LGBTQ people are stigmatized. Access to sanitation and menstrual products are also stigmatized issues. And it's important that we include this in our line of work because these issues impact our health, impact our safety, impact our dignity. And they most disenfranchise people who are experiencing homelessness. And we need to make sure we are showing up for them, making our voices loud and clear, and telling the city and the county of San Diego that we deserve better. Period.